In clinical practice, most patients with severe infections and have a history of repeated hospitalization are often referred to the emergency department. Infection-related severe pneumonia and sepsis are often life-threatening. Sepsis alone kills approximately 11 million people worldwide every year. Those at the highest risk of developing sepsis include the elderly, pregnant women, newborns, HIV or AIDS patients, and immunocompromised cancer patients. To substantially reduce the risk of death, accurate and timely identification of the causative pathogens is crucial for selecting the right treatment for the patients. Currently, blood culture is still the gold standard test to identify bloodstream pathogens. However, this process can take 2 to 7 days, with the positivity rate less than 20%, which means in over 80% of the cases, the pathogens remain unidentified. Recent advances in nucleotide sequencing technology is considered as a more promising approach for pathogen detection. However, to detect the extremely low amount of microorganism, host DNA interference is still one of the major obstacles to use sequencing technology in clinical microbiology. To overcome this bottleneck, Micron Brain Medical has developed a novel device, Devin Membrane. Devin Membrane uses the patented technology's Deuterionic interface ultra self-assembled coating technology to deplete white blood cells in the whole blood. In less than 5 minutes, Devin Membrane can achieve 95% leukocytes reduction for up to 8 milliliters of whole blood, while allowing other blood components to flow through and enrich microorganisms in the filtered blood sample. So, after Devin filter preprocessing, the patient's blood sample contains much less host DNA molecules, making the enriched microorganism much easier to be identified by the downstream sequencing test. Built upon Devin filter and our proprietary in-house database and bioinformatic analysis pipeline, Micron Brain developed a novel diagnostic assay named as Pathogen Real-Time Identification by Sequencing, PaRTI-Seq. PaRTI-Seq aims to identify pathogens by sequencing within 24 hours upon sample receival. With PaRTI-Seq, the right treatment can be selected and applied timely to the patients. This life-saving diagnostic assay is not only much faster, but also more sensitive and has the great potential to benefit much more patients in need. Micron Brain is committed to bring this accelerated, affordable, and accurate diagnostic test, PaRTI-Seq, much closer to the doctors and patients, making precision medicine in clinical microbiology a reality. Micron Brain. Seek the unknown and find it all.